Four Republican governors have sent a letter to the Republican leadership in Washington attacking the new health care legislation. Governors Kasich, Snyder, Sandoval, and Hutchinson write the current version of the House bill does not meet this test. It provides almost no new flexibility for states, does not ensure the resources necessary to make sure no one is left out. Earlier this week, Senator Rand Paul of Kentucky agreed that something else needs to be done, although for different reasons.
The problem is this, though. The leadership in the House is weak-kneed, and they are afraid to lead with freedom and capitalism, so they're giving you something that's half as much as Obamacare, but doesn't fix the problems.
Kathleen Sebelius was the Secretary of Health and Human Services for the Obama administration and an advocate for the Affordable Care Act, also known as Obamacare. She joins me now. Thank you so much for joining us, Secretary Sebelius. I want to start with your reaction to this letter.
Glad to be with you, Rena.
This letter that was sent by four Republican governors. I want to get your reaction. Do you think this is going to be a significant turn with the Republican leadership trying to overturn Obamacare?
Well, I think your clips that you've just played are a great example of what difficulty the Republican leadership finds themselves in right now. On one hand, you have conservatives saying, we want to get rid of more of the law. We want to move more people out of coverage. We want to withdraw more federal support from Medicaid, an entitlement program, from the subsidies that individuals are receiving to help buy health insurance in the private market. And the Republican governors, on the other hand, all members of the same party, are saying this bill goes too far to shift burden onto states, to cut the rug out from under people, to use their expression. And I think it is a dilemma that you have conservatives and more moderates, both of whom think the bill is not the right bill moving forward. I've said from the beginning, Rena, that I don't really know exactly what the goal is of this legislation. If it's to fulfill a campaign promise saying we repealed Obamacare, that isn't what the bill is, as Rand Paul says. That isn't done. It just cuts holes in the Affordable Care Act structure, but it leaves a whole lot of people really in far worse situation. If it's to try and fix some of the problems, lowering out-of-pocket costs, lowering drug prices, things that every American says this is what we want with health care going forward, the bill doesn't do that either. So I'm not quite sure what problem they're trying to solve, except for cutting off the amount of money the federal government's going to spend helping individuals buy health coverage. With the Medicaid program itself, this actually goes after the underlying federal-state partnership, which should alarm every governor in the country, that has disabled adults, moms and kids, seniors in nursing homes. This bill proposes that over time, about $800 billion in federal support be withdrawn from states, and that just shifts a huge burden to state taxpayers across the country.
When President Obama, just before he left office in January, he told Republicans, if you have a better plan, I'd like to see it, and that he would be on board if it was better than his. What parts of Obamacare would you like to see changed?
Well, I definitely think that the promise made by President-elect Trump and then President Trump were 3 points that he made over and over again. We would have insurance for everyone. This doesn't do that. We would have lower costs. This certainly doesn't do that. And you would not leave anybody in the cold and not go after entitlements. Again, promise broken. So I think that the American public has made it clear they don't want to see out-of-pocket costs continue to go up. And that's for people in this new market, but also lots of people who have employer-based coverage who are paying more and more of the costs. They'd like to see out-of-pocket goes down. That can be fixed. That can be fixed in the Obamacare framework. Everybody wants drug costs to go down and wants to know there's some control over some of these outrageous pricing schemes. Again, that can be fixed, but both of those require actually more government intervention, not less, more government regulation, The free market is not really serving people very well, because the free market in health insurance basically says if you insure people who promise never to get sick, you will make more money than if you insure people who get sick. If you don't have a balanced risk pool, if you only have healthy people, it's okay. And this bill moves back to healthy and wealthy folks being fine.
Right. And one of the concerns is that the younger folks won't have to buy into the system, who are less likely to actually have issues possibly. But I want to ask you that question again specifically. What part of Obamacare do you feel needs a little bit more work or needs some changing?
Well, I definitely think more cost help to folks. There's clearly a cliff in the Obamacare framework, and too many people felt that they didn't get the subsidy help they needed. I would certainly look again at the income levels. I would look again at more limitations on out-of-pocket costs. There are some in this bill for the first time. There need to be more, and I think ways to encourage more competition. I am a free market believer that more insurance companies in the pool really helps lower costs. And that's in place in many parts of the country, particularly in urban areas. But rural America, I'm in Kansas, and too many folks in our rural part of the state didn't have choices prior to the Affordable Care Act and have too few choices now. A public option, some help for balanced risk pools would really go a long way to encouraging companies to stay.
The way this bill stands is it has 3 phases. The second phase would give HHS Secretary Tom Price the power to put in regulatory modifications. It's a complicated term there. Can you explain what that would actually mean?
Well, I have no idea exactly what they're talking about, and I think that's part of the problem with this, again, pledge by the Republicans. There are 3 parts to this puzzle, and we're going to show you one of the pieces, and nobody seems to like the first piece, and take our word for it. The other 2 are going to be better, but we have no idea what that means. Any cabinet secretary has the authority to implement regulations based on a legal framework. What exactly he intends to do, what exactly the purpose of those regulations is, we don't know, because he hasn't talked about them. That's not new power. It's power that existed when I was the secretary, when Tommy Dobson was the secretary. So what is it that Secretary Price intends to do with that? What regulations does he intend to propose? We don't know. And they talk about a third piece of the puzzle being a new legislative package. But again, what does that look like? What are they proposing? I think that's why the American public said, show us the replacement plan before you do anything to repeal the act. That still is not the case. It's like there's secrets behind the curtain, but take our word for it, you're going to like them. Nobody likes what they can see so far, and we have no idea what's behind the curtain. What we know is the Congressional Budget Office says 14 million people will lose coverage next year. We know that states will absorb a lot of the cost of Medicaid. We know that older Americans will now be charged 5 times what younger people are charged in the insurance marketplace. And we know that subsidies won't be based at all on income. So those features are really not helping people who thought they may get a break with President Trump's promise that there'll be better insurance coverage and it will be affordable for everybody.
You know, markets don't like uncertainty. We know that insurers will come up this spring and decide whether or not to continue buying into Obamacare exchanges. Are you concerned that Obamacare could possibly unravel because there is so much uncertainty about what this administration plans to do with health care?
Well, I'm very concerned, and insurance executives have said just that. You know, they did a rate adjustment for 2017. Most of the consumers didn't pay that rate adjustment because the subsidies also went up, but they adjusted rates based on 3 years of experience. That, if you look at any new market, that's logical. That makes sense. What doesn't make sense is the continued uncertainty about what the rules will be next year, who will come in. We have, my understanding is, over 12 million people signed up in open enrollment this year, in spite of all of the promises that this bill would be gone. 12 million people signed up. They don't know if they're going to have coverage a year from now. And the insurance companies, who now have about 37% of that market as young, healthy individuals, have no idea if that will be the case a year from now. So they are now looking at total chaos, uncertainty with consumers, and certainly uncertainty with what it is that they're supposed to do with their business model. And I don't have any idea what they will know more clearly by June, which is the deadline for beginning to file rates for next year.
Okay, former Secretary of Health and Human Services Kathleen Sebelius, thank you for your time.
Great to be with you, Rena. Thank you.